All right, we'll start in like a minute or so. Let people know that we're live right now for a Instagram discussion with Dr. Bruce Campbell. And once it hits noon, we'll get started. Are you ready?
Terrific. Absolutely.
Good.
Thanks for having me.
Oh, of course, no problem. Make sure that we project so that people can hear us from all the way across the room. Well, it just told me. There we are. We have people who are joining us already. Hello. Let's get started. My name is Nicole. I'm the social media manager, and I'm here with Dr. Bruce Campbell of Lahey Hospital Medical Center. He works in executive health. It's among many other things, it is Men's Health Awareness Month in June, and we want to talk about some of the behaviors that men do normally that makes things a little bit unhealthier for them, lower life expectancy. So we're just going to get right into it. Let's just start with it. Would you say that the life expectancy for men is lower than it is for women?
Yeah, great question. Actually, since 1950, there's been a persistent 5-year gap in life expectancy compared to men and women. And interestingly, men do start out with bigger numbers early on in life. There's more male infants born than female infants. But as we age, men more rapidly die off, and this disparity accelerates as we get older.
Wow. And of course there's chronic diseases and illnesses and genetic, illnesses that I'm sure might impact certain groups of people, whether that has to do with your race or your gender or any other kind of background where maybe these numbers can fluctuate. But overall, it sounds like this gap, would you say it's pretty general, just men versus women?
Absolutely, men versus women, and certainly a lot of behavioral problems with men that lead to this premature death and disability.
Mm-hmm. Would you say that's a main contributing factor, preventable behaviors?
Yeah, for sure. If you look, there's a lot of guys out there that are not getting enough exercise, and they're following these deplorable diets.
Yeah, let's talk about some of these behaviors that men actually, participate in that sort of brings that life expectancy down, that widens that gap. In fact, one of them is alcohol. Men tend to drink more, but they're also given, granted, women are allowed one glass of wine, men are allowed 2 glasses of wine a day, one alcoholic drink. Women, men get 2. So does that kind of play into it? It's like, well, I can drink more than a woman can, so I'm just going to drink a lot.
Well, it's interesting. There's such a concept called risk drinking, and if a guy has more than 2 drinks a day, he's officially called a risk drinker.
Wow.
And the reason it's called risk drinking is that increases his risk of bad health outcomes. So specifically, car accidents, liver disease, high blood pressure. Something you're going to hear more and more of is that alcohol acts like a carcinogen, meaning it can cause cancer of the mouth, the esophagus. So certainly men are more likely to abuse alcohol. They're actually also more likely to accidentally overdose on drugs. Unfortunately, with the new opioid epidemic, believe it or not, drug overdose is now the leading cause of accidental death in men ages 25 to 64.
Wow.
It's pretty mind-blowing.
Yeah, that's a big number. That's a large range.
Absolutely, and it's hard to believe that it's even surpassed motor vehicle accidents as the leading cause of accidental death.
Really? Wow.
Pretty grim.
Yeah, that is pretty grim. Speaking of reckless driving and car accidents, that's another thing that men tend to do a little bit more. Does that have to do with the alcohol part, maybe the drugs part? Does it have to do with some road rage tendencies? Is it kind of a mix?
Yeah, I think you're hitting it all. It's interesting. I think women always get a bad rap for being the bad driver, but statistically throughout life, men are more than twice as likely to be killed in a motor vehicle accident. And it's a combination of speeding, not wearing their seatbelt, driving intoxicated, practicing road rage, and then even more recently, just using their cell phone. I see a lot of male patients who conduct business calls during their commutes, and certainly distracted driving from using your cell phone is now a major cause of car accidents and motor vehicle fatalities.
We're actually in the 100 deadliest days of the year, according to several sources. Mainly it's for teens, because teens are now on the road, they're out of school, so they're driving around a lot more, participating in, parties, going out drinking. But 3,500 people, I believe, will be killed or involved in a fatality accident with a teenager. I think that was reported over about 5 years or so. I might be wrong on those numbers, but about that. So we are actually in that time where people generally are just a little bit more reckless with their driving.
No, absolutely. A lot of people, particularly in the New England area, taking their weekend road trips. Kids coming home from college. I know my boys at home are tired of me always telling them to drive safely.
Yeah.
But it turns out that for a young man, a motor vehicle accident is the leading cause of badness. So.
Wow. Let's move on to suicide. I think that when we first had our conversation getting ready for this, you mentioned some numbers to me that suicide is the 7th leading cause of death in men.
Yeah, it's quite disturbing. This is where I think men can learn from women how to take better care of ourselves. Women, when they feel down or distressed, are just much better in reaching out for help. Men, on the other hand, are conditioned to hide their emotions. So unfortunately, this will result in a guy feeling isolated, angry, irritable, and frequently they'll start to engage in destructive behavior, such as what we just spoke about, alcohol and drug abuse. Some men become workaholics, get divorced, and engaged in other unhealthy issues. Married men, I always encourage my married men to stay married because married men tend to be healthier.
Yeah.
Their spouses, the women in our lives are good at ripping the red meat out of our hands and dragging us out of our cave and making us social. But unfortunately, single men don't have that. But if you look at the end of the day, to your earlier point about suicide, it's a major cause of death, and clearly the time-honored approach of manning up is not an effective solution.
Right. Well, I think what I've noticed more so now is that men, maybe younger generations, seem to be embracing the fact that we have to have more open conversations about our mental health and taking care of ourselves mentally, emotionally, and being able to ask for help. But it seems that just older generations probably socially.
Yeah, no, I would agree. I think this is an educational issue, and back in the day, these days, again, I see it in my own kids. They're certainly much more savvy and sophisticated than when I was growing up. And I think schools are doing a better job just educating, kind of knocking down these gender barriers and limitations.
Right. You mentioned a phrase that I want to use to sort of transition into the next thing, sucking it up. You have a phrase, or there's a general phrase called suck it up syndrome, so we can sort of transition over the patients that come in here or the patients that you see, and just the relationship between men and their doctors. What is suck it up syndrome? Let's start with that.
Yeah, I'm not sure if you picked up a medical textbook, you'll find it in there. But I use it to refer to men. There's just many men out there who just avoid doctors like the plague.
My father is one of them. I want to make sure that that's recorded.
Looks like you're in trouble. But certainly, this is a downfall of men. Some men are better than the others. And again, I think this is where we could learn from women. Women statistically are just much better going to the doctor and getting screenings. I think this suck it up syndrome occurs during childhood, particularly on the sports field, when somebody falls down, skins their knee. The message is frequently get up and suck it up. And unfortunately, later in life, that can translate into a man ignoring potentially worrisome symptoms. So the guy who is out shoveling snow experiences chest pain and takes one for the team and ignores it. It's that same guy who maybe a couple weeks later is in the emergency room with a heart attack that he could have prevented if he had spoken up early.
Right. What is that? Is it so? I mean, it's clearly the social norm that we mentioned already that doesn't men don't want to look weak, and it is conditioned, at a young age. But we have the data, I would say, and we know the science, and we've seen it, and maybe we've even seen it in a family member or a close friend. These are pretty common events that happen, shoveling the snow or playing basketball, or just we hear these stories often. So why does it seem to be a continuing trend?
I just think, perhaps we're a little bit hardwired that way also, but it's just something that we have to keep confronting the challenge. The best way is just keep trying to educate men. One thing I always try to impress upon men is that they can feel great but still have killer numbers. So, often you're not going to feel if you have high blood pressure. You're not going to feel if you have high sugar or high cholesterol. And the only way you're going to know is if you see your healthcare provider. So I always encourage men to know their numbers.
And they'll get those numbers from their
by going to their healthcare provider and getting blood work, and then acting. Left unattended, over time, unhealthy numbers can lead to heart disease and diabetes.
Do you find that men are going to be more vocal, especially if they're not surrounded by other people where maybe other people might see them being weak, but do you think that they're having honest conversations with their doctor, or what are ways that a doctor could potentially get them to be a little bit more open when they're having these conversations in the exam room?
No, it's a great question. I think another reason that male patients avoid the doctor is they tend to feel embarrassed or awkward about talking about things, and that's where I try to let them know that they're not the first person to have this worry or concern about this perceived awkwardness. And the truth is that usually whatever they're concerned about saying is shared by many. I also think or find it's helpful just to be very direct and honest with patients.
Right.
I ask all my male patients how they're managing their stress, and I think by doing so, it validates that it's completely normal for a man to experience stress and anxiety, and it's not a sign of weakness.
Right.
And if you don't acknowledge stress and work to manage it, stress will end up managing you.
That's absolutely right. Right. Okay. All right. Do you have any other advice for men in terms of targeting, I guess, the unhealthy behaviors, as well as again having those honest conversations in the office?
I think that the challenge has always been about how do you get a guy to be healthier. That's the challenge that I experience every single day. And when I look at my practice, those men that clearly make a change for the better, it's usually as a result of them either personally having had a bad health event or having them witnessed a friend or a loved one have a bad health outcome. In those situations, it strikes close to home,
right.
And it spooks them
right.
to change their habits. So clearly the goal is to try to intercede before a bad health outcome occurs. I find that when patients come for their annual physical, that just simply showing them their abnormal numbers or test results can be highly motivational to change behavior. For those people that do not get or seek health care, that's where I think we need to do a better job reaching out to them. And this is where I credit women for being highly successful in advocating for their health.
Right.
One example, in prior Octobers, we've seen football stadiums turn pink in support of breast cancer awareness, which is just a fantastic and powerful venue.
Right.
But I would love to see the same effort applied to a men's health topic. Perhaps in November, when many men grow facial hair to increase men's health awareness. Wouldn't it be nice to see Tom Brady and his compatriots grow mustaches? And
we have to get that has Bill Belichick first, I think.
and then even wearing blue wrist bracelets that say "Know Your Numbers."
Right.
I mean, if guys love sports, and what better venue than to have professional athletes who everybody in New England adores?
Right.
Bring that message to them.
Yeah, to raise more awareness and to get it wider out to more people. I agree, and correct me if I'm wrong, but it sounds like men are more reactive. So you're saying, I now know that my numbers aren't great, or I've seen this happen to a friend or a loved one. I guess it's time for me to take charge of my health a little bit more responsibly. Versus being proactive. I want to avoid these things in the future, so I'm going to take care of this now. Would you say that that's true?
Yeah, that's good. I'm a guy, so I can say this. I think women are 10 million years more evolved than us. We're a simple creature,
Yeah.
and we do respond to numbers. They can be very powerful. And the way that the world runs these days, most men are responding to numbers in one way or another through their jobs or whatnot. So numbers resonate, results, objective data resonates well with men.
And in terms of that relationship with men and women, I know I do this with my boyfriend where, okay, like, have you gone to the doctor? All right. And, you want to pull back because you don't want to sound like that 50s term. You don't want to sound like a nag. But then maybe that conversation is lost in terms of impressing upon somebody the importance of taking care of their health. So how can the significant others and the moms and the daughters and the wives be able to sort of get through to the men in their lives about, we can do it, we're doing a pretty good job of it, we want you to do the same because we care about you and want you to take care of yourself?
No, I would argue that nagging is a good thing, and I would encourage you to continue to do so. And that's simply based on, I do see a lot of men who would not have come to their appointment had it not been at their female companion's urging. So keep up the good work.
All right. Don't stop nagging. Well, if you guys have any questions for us, please leave them in the comments. We will make sure that we make this available on YouTube. Do you have anything else to add?
No, I think you've done a fantastic job with these questions, and I think that the take-home message is there's just a lot of preventable death and disability and diseases simply by taking action. Simply by exercising, eating healthy, doing the things we discussed can really make it pay big dividends.
Great. Well, Dr. Bruce Campbell, I really appreciate your time. It's Men's Health Month. We're going to sign off. But again, this will be available on YouTube, and it will be available on our Instagram story for a little bit as well. So please take a look. And you can also find more of this information on Healthy State, probably starting next week. Thank you so much. I really appreciate you taking your time. Have an amazing weekend. Have an amazing weekend, everybody. Thank you. Thank you. All right, make sure you